Hi, you guys. Welcome to the special edition of Warriors Talk with Lady Rochelle, where we move away from awareness towards action. This is Breast Cancer Awareness Month. So, for the next 31 days, which we are already in day 5, in October, I will be giving you breast cancer awareness facts that you can take, put it in your toolbox. You can share it with somebody, use it as you may see fit. But coming out of Breast Cancer Awareness Month, I want to make sure that it's not just all about the color pink, but we are learning something, and we are actually learning how to take our awareness and turn it into action. So today's risk is we're talking about risk factors. What risk factors do you have as a result and as it is linked to breast cancer and your risk of getting breast cancer? So do me a favor, like and share this video out so that somebody else can get this information. It would be greatly appreciated. You can comment, you can ask questions, or the best thing that you could do for yourself or for someone else is to just share the video. So, what is your risk factor as it relates to breast cancer? A lot of times we think that, oh, I don't have any risk factors. I don't know anybody in my family that had breast cancer or any type of cancer. And I just did a show with Diana Burks at 6 o'clock on Intellectual Radio where we talked about being breast self-aware. Please go back, click that show. She did a demonstration on how to do it. She gave us some valuable information about the changes in your breast and what to look for. Go back and click that video so that you can get that information. So right now we're talking about your risk factors as it relates to our breast cancer diagnosis. So there are some things that you can change and there are some things that you cannot change as it relates to your risk factors. The things that we have control over, those are the things that we really need to focus on just to make sure that, we are decreasing our chances of getting a breast cancer diagnosis. So your risk factors that you cannot change: getting older. We can't do anything about our bodies getting older. So if you are age 50 and older, then you are at most risk for breast cancer diagnosis. And we know that people are getting diagnosed in younger ages. So that's why it's important to start learning what your risk factors is at an early age. So the breast cancer risk increases with age. So most breast cancer diagnoses are, they say after the age of 50, but we all know somebody. I was 43. We all know somebody who was younger that was diagnosed with it. But on average, they're saying that it's women who are over the age of 50. So another risk factor that you cannot control as it relates to breast cancer is genetic mutation. We talked about this last night, so you can go back and you can replay it. We talked about gene mutation, which is your hereditary link to breast cancer. So you can take a test if you know it runs in your family. You can take the BRCA1, you could take the BRCA test, not the BRCA1. You could take the BRCA test, and it's going to determine if you have a BRCA1 or a BRCA2 gene mutation, which tells you that you have a hereditary link and what type of cancers that you are at a high risk for. So those individuals who test positive for the BRCA1, they are at a 87% chance of getting breast cancer, 57% chance of getting ovarian cancer. So it's important to know your family history so that you can determine if you need to get this test done. So this is something that you have no control over, which is your gene mutation, which can be a hereditary link to breast cancer. Your reproductive history. So if you got your menstrual period earlier, before 12 it says, or starting menopause after the age of 55, which women are exposed to hormones longer, then you are at risk for breast cancer. So just sit back and think about it. What age did I get my period? Or if you're going through menopause right now, think about the things that you can do to decrease your risk. So again, these are things that you cannot do. You cannot change the fact that you're getting older. You cannot change the fact if you have a hereditary link, and you cannot change the fact if you got your period earlier, or if you started menopause after 55. That is things that you do not have in your control. If you have a personal history of breast cancer or certain non-cancerous breast diseases, then you are at a higher risk for more likely getting a second diagnosis. So this is something that you can't change because you already had the first diagnosis. So you can't change the fact that, okay, now I may be at a higher risk for getting a second diagnosis. So this is something that you can't take away, that you already had that first diagnosis, and it puts you at risk for a higher chance of getting cancer again, getting diagnosed with a second cancer. Family history of breast or ovarian cancer, that is something that you do not have control over. You can't do anything about it, but take that knowledge and use it to try to talk to your doctor to figure out what game plan that you can do moving forward, now that you know that you have a family history of breast or ovarian cancer. If you have a mother, a sister, a daughter, a first-degree relative, or multiple family members, it puts you at a higher risk. And that's something that you can't do anything about. But you can take that information and you can use it as power to take it to your doctor and say, hey, this is what I'm dealing with my family. Where do we go from here? Okay, so you can have some power, right? Everything, cancer doesn't always have to have everything. So these are risk factors that you can change. This is things that you have the power in your hands with this knowledge to do something about your chances of cancer, reducing your risk, knowing your risk factors. So these are things that you can change, and many of us have the opportunity to do so. Be more active. If you're not active, then that's something that you are just letting the control go to waste. You have the control to be more active. It says women who are not physically active have a higher risk of getting breast cancer. The recommended is 150 minutes per week of exercising. Whatever it is that you're doing, cardio, walking, you're in the gym, you're doing weights, whatever it is that you like to do that gets you going, get your heart rate going, do that for at least 150 minutes or 30 minutes a day, so that you can control your risk factor from getting breast cancer. A lot of us are overweight. Well, a lot of y'all are overweight. If you are overweight, being overweight or obese, it says after menopause, older women who are overweight, you have a higher chance of getting breast cancer. If you notice, with all of the diseases, they talk about your weight and being being proportion, your height and weight being proportion, being in your right weight class, so that you won't get not just breast cancer, but these diabetes, having heart disease, all these other things that come along with you not being at the right weight. And 70% of African American women are overweight. For some reason, we have taken the overweight as a norm for how we should look and feel. Not so. So look on the internet and find out, hey, I'm this tall. What should be my weight? What weight class should I be in? And then reach for that goal or something surrounding that goal. Remember, weight and physical activity is something that you can control. Taking hormones, if you have some type of hormone replacement or even birth control pills, certain birth control pills have you at a high risk, put you at a high risk for cancer. So if that's something that you can control, try to do something else other than the birth control pills, because it's putting you at a high risk. If you're doing some type of hormone replacement therapy, during menopause, it's putting you at a high risk. Think about the things that you can control and own them, control them. The reproductive history. So if you had your first pregnancy after the age of 30, I know with women we have our careers and we want to be established before we have these kids, but it says having your first pregnancy after the age of 30, it puts you at a high risk for breast cancer. Not breastfeeding. If you are not breastfeeding, you just grabbing that formula. To each his own. I breastfed all 5 of my kids, and I still got breast cancer. So, but it decreases your risk, So it says it decreases your risk, and then never having a full pregnancy can also increase your risk. So these are little things that you can do. You can breastfeed your baby. If you want to, breastfeeding for 6 months to a year, it decreases your chances of doing it. Have your baby before 30. These are things that we can control. These are things that are in our hands. We're talking about the risk factors right now that you can control. Another one is drinking alcohol. Studies show that a woman's risk for breast cancer increases the more alcohol she drinks. So you go and you hey, I want to drink, and it did say that you could drink 1 drink a day, but some people just go overboard. They go overboard with it. Don't drink at all. Then you ain't got to worry about that risk, right? And you ain't got to worry about that risk for other things as well, because alcohol doesn't just increases your risk of breast cancer. There's a lot of other things that it can affect in your body when it comes to disease risk. So there are things that you can control as it relates to risk factors to breast cancer, and there are some things that you cannot control. So concentrate on the things that you can control, and the things that you cannot control, talk to your doctor about them and see what's the best way to tackle those things. So what did you learn today about breast cancer risk factors? Are you at risk? And if you are at risk, what are you doing about it? Are you turning your awareness into action? What are your takeaways from risk factors? What we talked about tonight. What are your takeaways? What are some of the things that you're going to start incorporating in your life that you have control over, the things that you can do? Start doing those things today. Little baby steps at a time to get you in the right place to where you have control over the risk factors that are in your hands. So that when you go to the doctor or you learn of a family history that you have a link to breast cancer, then you're already doing things to lower your risk. Cancer does not always have to have the upper hand. You have things that you can control. You have things that you can take in your hands and say, hey, I can control my weight. I can control exercise. And I can talk to my family about the history and find out what's going on. So there are things that you can do. I cannot do birth control. I can breastfeed my baby. There are things that you can do. Turn your awareness into action. Thank you for tuning in to Warriors Talk Special Edition, 31 Days of Breast Cancer Awareness with author and founder Lady Rochelle. Join me tomorrow night, day 6 of 31 Days of Breast Cancer Awareness. This is Warriors Talk, where we are changing lives one warrior at a time. See you tomorrow.